Hi, my name is Hafizal.
I am Syameel.
We are from course CC 104, section 1.1.
So, what we gonna do today?
Today, we are going to be talking about the danger of smoking. Let's go.
go. Pa! Smoking may seem like a habit or a lifestyle choice, but behind each path lies a storm of serious health risks, many of which people often overlook or underestimate. This presentation aims to shed light on the devastating consequences of smoking that affect not only the smoker but also those around them. One of the most alarming dangers is the increased risk of cancer. Smoking is strongly linked to a various forms of cancer, including lung, throat, mouth, pancreas, bladder, and even cervical cancer. Shockingly, smoking is responsible for 1 in 5 cancer-related deaths. Its disruptive chemicals attack healthy cells, altering their DNA and promoting the growth of deadly tumors. For women, the risk of escalate during pregnancy. Smoking while accepting a child can lead to premature birth, low birth weight, and even sudden infant death. Syndrome, SIDS, it doesn't stop there. Female fertility can also be disrupted, making it harder to conceive and increasing the likelihood of complications. When it comes to reproduction, smoking takes a heavy toll on both men and women. It can reduce sperm count, damage sperm DNA, and interfere with ovulation. These changes lower fertility rates and increase the risk of miscarriage and birth defects. Beyond reproductive health, smoking wreaks havoc on the brain. It increases the risk of stroke and damages blood vessels, reducing oxygen flow and impairing cognitive function. People who smoke are more likely to suffer from memory loss and difficulty concentrating. The lungs suffer the most immediate damage. Smoking causes chronic obstructive pulmonary disease, COPD, and lung cancer, both of which lead to breathlessness, coughing, and frequent infection. Damaged airways and air sacs make even the simplest physical activities feel exhausting. Lastly, the heart is far from safe. Smoking hardens arteries, promotes the buildup of plaque, and forces the heart to work harder. The result? Elevated risk of heart disease and sudden heart attacks. Statistically, smokers lose about 10 years of life compared to non-smokers. It's also linked to over 50 major health conditions and contribute more than 100,000 smoking-related deaths annually in the UK alone.
Based on what Syameel has just said, smoking has long been recognized as the leading cause of chronic diseases, but its impact goes far beyond the lungs. It coyly sabotages multiple systems in the body, leading to irreversible damage that many fail to notice until it's too late. From weakening bones to clouding the vision, the consequences of smoking are extensive and deeply troubling. One of the lesser-known effects of smoking is its role in hearing loss. The toxic chemicals in cigarette can cause plaque buildup in blood vessels, restricting blood flow to the inner ear. This disrupts the delicate structures responsible for sound detection and balance, increasing the risk of early hearing impairment, particularly in those prone to ear infections. Other than that, the skeletal system also suffers. Nicotine disrupts calcium absorption, which is essential for maintaining bone density. This makes bones brittle and more prone to fractures. What's worse, smokers often experience a slower healing, meaning a simple break could become a prolonged and painful recovery. Cosmetic effects may seem trivial compared to internal damage, but they matter. Smoking accelerates skin aging and degrading collagen and elastin, leading to wrinkles, dryness, and a loss of elasticity. Hair health also declines as the immune system weakens, making strands more fragile and prone to falling out, impacting not just appearance but confidence too. So, mental health is no less vulnerable. Nicotine alters brain chemistry, increasing the likelihood of depression and anxiety. Over time, it can impair cognitive function and heighten the risk of dementia, eroding memory, reasoning, and emotional balance. And of course, the mouth bears the brunt of smoking's damage. It promotes excessive plaque buildup, turning teeth yellow and rotting their protective enamel. Smokers are more likely to suffer gum diseases and persistent bad breath, which affects their self-image and interpersonal interaction. In short, smoking is more than just a habit. It's a full-scale assault on the human body. Its effects are insidious and widespread, affecting everything from the way we hear and see to how we think and feel. Awareness of these consequences is the first step toward healthier choices and a better quality of life. Smoking is not just a habit. It is an addiction that negatively affects both physical and mental health. Many smokers wish to quit but face major challenges such as nicotine cravings, social pressure, and emotional struggles. However, quitting smoking is not impossible. With the right strategies and consistent support, anyone can break free from the grip of tobacco and enjoy a healthier, more fulfilling life. The first step in quitting smoking is to set a quit date. Choose a date in the near future and mark it as the beginning of a smoke-free life. Informing family and friends about this decision can provide valuable moral support throughout the journey. Next, it is important to identify the triggers that lead to smoking. Some individuals are used to smoking after meals, while drinking coffee, or even during stressful moments. Recognizing these patterns allows one to replace them with healthier activities such as walking, drinking water, or chewing gum. Nicotine replacement therapy, also known as NRT, such as nicotine patches or lozenges, can help reduce withdrawal symptoms and ease the transition to a smoke-free lifestyle. These products are available at both pharmacies or even through government-supported quit smoking programs. Emotional supports play a crucial role as well. Joining support groups or counseling sessions can offer continuous encouragement and allow individuals to share experience and success stories. At the same time, smokers are encouraged to stay busy with positive activities like exercising, reading, or spending time outdoors to distract from cravings. Avoiding high-risk situations is also wise, such as staying away from smoking areas or temporarily distancing from friends who still smoke. This helps reduce temptation and makes the quitting process smoother. Healthy eating should also be prioritized, as it helps manage weight gain after quitting and naturally refreshes the body. Finally, it is essential not to give up if a slip-up occurs. Smoking a single cigarette does not mean failure. Instead, treat it as a minor setback and continue with stronger determination. In conclusion, quitting smoking requires discipline, support, and awareness of the long-term benefits such as improved health, financial savings, and better social relationships. This step not only saves the individual but also protects their loved ones from the harmful effects of secondhand smoke.
In conclusion, smoking is more just than a daily habit. It's a silent trait that slowly destroys health. Yet, the courage to quit is one of the wisest decisions a smoker can make for a brighter future. The journey may be challenging, but with the right strategy and continuous support, the dream of a smoke-free life is absolutely achievable. A life without cigarette promises not only better physical health, but also peace of mind, stronger social relationship, and greater financial stability. Every step taken toward this change is a reflection of inner strength and the desire to live more meaningfully. So, let's take that first step, not tomorrow, but today, because a future free from smoke is waiting.